Welcome to the Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. And today, my guest is Heather Fork. Heather is a physician coach, and she's going to tell us what that means, what kind of certification a physician coach should really have, and how you know whether you need a physician coach. But before we get started, I'd like to thank our sponsor, Comp Health. If you're a physician looking for a new job or considering locum tenens for the first time, check out Comp Health. I've worked locums with Comp Health. I appreciate the personalized experience with a recruiter dedicated to my specialty, who knows my needs and goals. Comp Health also offers full-time permanent jobs if you're looking for a longer-term switch. For more information, check out comphealth.com. And now, without further ado, I'd like to welcome my guest, Dr. Heather Fork. Heather, great to see you again.
It's fantastic to see you, Andrew. I am a big fan of yours, and I'm truly honored to be here.
So you listen to the podcast, right?
Yes.
All
Yes.
right, terrific.
Yes.
Do you listen on Apple or Google or Spotify or Stitcher or iHeart? Where?
Apple.
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 All right.
Yes.
I looked at my stats. About half the listeners listen on Apple, and of course, you can watch it on YouTube, and see us almost in person. Well, today, I think I first interviewed you about a couple, 2, 3, maybe 4 years, 2 years, 3 years ago on Medscape, because
Oh,
I
right.
just started to bump into this physician coaching phenomenon. And I listen to a lot of podcasts, and more I've been stumbling on physician coaching. So you have been a physician coach for how long?
Uh, 12 years.
12 years.
Yeah.
Okay.
12, yeah.
So it's not new for you. Well, why don't you tell us how that happened? And then we're going to talk about who needs a physician coach. You could give us some examples of, doctors you've coached and what happened. But how did it all get started?
Once upon a time, you
What's
know,
that?
I was a dermatologist, and I didn't really know it at the time, but the seeds were planted early. When I was in practice, I started going to these different courses that teach you how to do things to change parts of your own life. Change how to change yourself by changing your handwriting was one of them. And I also started studying personality types and learning the Enneagram. And then I would come back from these courses, and then I would get my esthetician or one of my friends to go through this 40-day process of making changes in their own life. And I didn't call it coaching. I don't think I really knew what coaching was, but I loved doing it. So then I ended up leaving dermatology after 9 years, and I've talked about my story a lot, so I won't belabor it here. But just the punchline is that it really wasn't the best fit for me, even though I liked it. The practice was successful. I love being a coach. I don't think I loved being a doctor in the sense of being the person dispensing all of this information. I like finding out answers from other people. So when I left dermatology, I really didn't know what I was going to do. I left without a plan because I thought I needed some time to figure it out. And I went out into the country, I lived in the cabin, and then when I was ready to get back into the working world, I just made that declaration I'm going to figure it out. And in 2 weeks, I knew that I wanted to become a coach just by listening to this thing called the passion test, which helps you figure out how you want to live your ideal life. And when I was taking this passion test, I just stopped in the middle. I threw it up in the air and I said, this is what I want to do. I want to help other people have a life that's really meaningful for them. And that's when I started researching coaching programs.
Just like a physician, you wanted to help people, but in a slightly different way.
Yes, exactly.
Did you use a physician coach along the way to get to that kind of eureka moment?
No, I didn't. I bought that book when I left practice. What color is your parachute?
Uh-huh.
I read the first page and that was it. And after when I went to coaching, and then when I did my coaching program in certification, you have to have your own coach. And so I hired a coach at that time, and she happened to be a physician coach. And I'd already decided that I wanted to help physicians, but she helped me get my business started. But as in terms of figuring out the what I was going to do, it took being out with a cactus in the hill country, living near Willie Nelson. I don't know if that had anything to do with it, but just I think following my heart and doing things that interested me that weren't necessarily going to lead to a job, somehow I think that reconnected me with my true purpose.
So aligning your personality with your profession is.
Yeah.
So Heather, you started out as a physician coach 12 years ago. Can you give me an example of, I don't want you to reveal any identities, but give me an example of physicians who had a problem who you helped. How do I know, for example, if I need a physician coach? Can you speak to that?
Absolutely. That's a great topic. And I'd say the physicians who come to me for help end up following in a number of different categories. And I'd say, sort of, the first category are those physicians who are new attendings. So they're in that time when you're having to be responsible for the patient. There's the buck stops with you. And that's when a lot of the imposter syndrome can come in, self doubt, lack of confidence. So I've worked with a number of physicians, whether they're surgeons or psychiatrists or clinicians, to figure out if this insecurity that they're feeling means that medicine isn't really the right fit, or they just need to get more confidence. And so I have a number of physicians who really were wanting me to explore non clinical options with them. But when we worked together, I discovered that that heart for medicine was still there. They really wanted to help patients. And we worked with the anxiety and the imposter syndrome. And it doesn't really take that long. Usually within 3 to 4 months, they're doing really well. And so that's really encouraging to see.
Is a big part of it just knowing that this is a syndrome and that other people have it and it's kind of a expected or common phase? Just is that reassurance make a difference, do you think?
Oh, that's huge. Because a lot of them think it's just them. And then when they talk to other people, which they might even talk to partners or colleagues, they're usually told this is normal, it will get better. So that's helpful, but they still need some strategies to work with that anxiety when it gets in the driver's seat. Because if you don't find a way to stop it, it gets worse.
Now, how do you know when you have a client and you're discussing something like that, when they need more of a therapist than a coach? It's kind of gray to me where that line is between, coaching and improving your life. You mentioned anxiety. I mean, that's a kind of a mental
Mhm.
health symptom. It's also a normal part of life. So for you as a coach, how do you decide, this is great coaching you, but you need more help? How do you do that?
That's a really powerful question, and some of my clients are working with a therapist concurrently, and that can be really helpful.
Sure. Well, that takes the pressure
Yeah,
off.
yeah, and they're additive in a way, but in coaching, if I'm working with someone who doesn't have a therapist and I feel like they're not able to make some changes pretty quickly in how they're feeling and responding to things, that's when I would suggest a therapist.
Now, the imposter syndrome. It's pretty. Give me an example of a strategy. You said you need strategies. Can you give me a tangible? Okay, I'm feeling nervous now. I'm making rounds. I've never really done this before.
Mm.
I think I know what I'm doing, but I'm really not sure. So now what? What's my strategy?
Well, you gave a great example there because so much of it is controlling your thoughts. As often there's all these thoughts that are interfering, that are telling you you're not good enough. Who do you think you are? That someone's going to find out that you just got here by a fluke, and then they start thinking of worst case scenarios like, oh, it's probably a headache, but it could be a brain tumor. It could be this. All about these things, and they're scaring themselves. So a lot of it is starting to learn how to control your thoughts. There's also some techniques I do with visualizations where you see that part of you that's anxious outside of you. It sounds kind of funky, but that way you're not the anxious part, and there's ways that you can help that part of you. It
Just
is
smack
it
them
is
around a little
therapeutic.
bit.
you, but I found that to be one of the most effective approaches when they learn to be able to be the confident self while that part is having trouble, so they can help it. And that whole term of self help can be a misnomer when you're the one having the problem.
I like that. I like that kind of a separate, like the little devil on your shoulder,
Yeah.
right? It's a kind of a
Mm-hmm.
separate entity that you can
Mm-hmm.
address. Now, when people call themselves, I mean, anybody can call themselves a coach,
Yes.
but there is various certifying agencies, and I don't know anything about those. It's like you see all these initials. Which ones? Well, which one do you have, for example? And which ones would you say are like legitimate that one should look for when searching for a coach?
The certifying body that's the most established one is the International Coaching Federation. It's also known as the ICF, and they accredit the coaching programs, and they accredited the one that I went to. So when you choose a coaching program that's already been approved by the ICF, then it's much easier if you want to get additional quote unquote certifications after your name. That's where I got my master's of coaching certification, the MCC, but I couldn't get that until I'd done 2,500 hours of coaching already.
Let me stop
And
there because I'm going to interrupt you because, some people say, oh, yeah, I'm a coach. I took a weekend class. So it was 2,500 hours.
mhm,
So let's see. I don't know. I have to figure out how long that took, but it must be at least a year, right, of
mhm,
of
mhm.
study to get that number. So it's not. And is that something you have to do full time, or could you be working while you're getting your coaching, or do you really have to throw yourself into it like going to college?
Right. And just to make a distinction, you can become a certified coach by doing a training program and doing a minimum of 100 coaching hours. That'll get you the associate certified coach, the ACC, that level. And so you can do that training while you're still working a full-time job. You just need to have some bandwidth. So you could become quote unquote a certified coach while you're still working a pretty busy job. I added on the master's in coaching certification. So that's what required an additional 2,500 hours. Plus, you have to do these you have to do these recorded sessions with your clients that then go to the ICF, and they have all these measures that you have to hit and accurately do a coaching session according to their criteria. And I spent about a year doing the training for that and working on it, and but I learned so much from it.
Okay, well, I think it's like for airline pilots. There are pilots who are certified as private pilots. You can easily certify with 100 hours, but
Hmm.
but that's a lot different than the pilot that has 2,500 hours. At least if you're taking me as a passenger, I know
Yeah.
which one that I want.
Hmm.
So you've taken this, I would say, as a pretty serious career move to get your master's, 2,500 hours, and also I think that's an interesting experience to share your consultations. I mean, that's kind of nerve wracking, particularly when it's on video because it doesn't go away. If you just had someone sitting in the room or watching through, one way glass, at least it's all over, but the video never goes away. So you get to your mistakes are memorialized there for forever. And I guess you had to let your clients know that they were.
Oh yeah, and actually, it was on the phone. I said video first, but it was on the telephone. And yes, you had to get written permission, and then they destroy those recordings after they grade you.
Okay.
Yeah,
Oh, that's a
yeah.
relief. All
Hmm.
right. Okay.
I would say though that there are different programs that are not under the ICF auspices. So there are good coaching programs that have their own bodies that that determine whether it's a certification that you get or not. The life coaching school is one that's not under the ICF, but I think it's a really good program. So I would say for people, I wouldn't get too hung up at this point on whether you're going to get certified or not. I think if you're interested, the best thing to do is just find a good program where they do a lot of actual coaching, where you get to practice these skills and get feedback versus didactic lectures about coaching, which won't really teach you that much. To first see how you like it. And if
Mm.
you like it, really consider about certification.
Now, I probably interrupted you. You were telling us about the several categories of your clients, one being those with anxiety and imposter syndrome.
Yeah.
What are the other categories? Who
I would
comes to you?
say, yeah, the next category are physicians who've been practicing for a number of years and they're burnt out. And again, they're still not sure whether they need to find a better clinical situation or add in something of interest or if they really need to transition to a non clinical job. So I've worked with hundreds and hundreds of these physicians, and some of them are able to stay in medicine and be happy, and that could be changing to a different practice. Some of them have even opened up their own practice, or they've cut back on their hours and they add in something like writing or even a side business just to feel like they're learning and still growing. And then another big group transition completely into non clinical careers. All the big areas: pharma, medical writing, physician advising, consulting. I have some have gone into coaching, some have gone into different ones you don't really hear about, like finance or graphic design, or I have a client who bought a dessert franchise. So there's quite a number of things you can do.
Well, I always tout locum tenens, and we've talked about this for those physicians who not happy with their current clinical career, but really don't want or not sure if they want a non-clinical career. So locum tenens is kind of a, working part-time or different places, a way to kind of reinvigorate your clinical practice for physicians who don't want to abandon that aspect of their lives. Any other categories that your clients fall into?
There are some who aren't sure whether they really are meant to keep practicing medicine. So, what they may do is take a break and do locums, like you mentioned. I think that's a wonderful way to keep the clinical door open, explore different opportunities, and also be able to have some bandwidth and recover because a lot of them are really burnt out
Mm.
and they don't want to be working all the time. And so I have a couple surgeons who have stepped back from crazy practices and they've really discovered I really love caring for patients. I want to keep using these skills, but they find a situation that's more flexible for them. And sometimes when they step away, they discover, I had a great run. I love my patients, but I really want to learn something new, do something different.
Now, I want to talk a little bit about the mechanics of coaching. So, suppose I call you and say, Heather, I'm burned out. I don't know what to do. Life is great, but, it kind of sucks. And I'm just confused. What do I do next? And so you say, okay, well, let's have a chat. And then what happens then? How long is our relationship gonna last? How often do we connect? How much is it going to cost?
Mm-hmm.
Just, some kind of ballpark idea that if I do kind of hire a coach,
Mm-hmm.
what am I getting myself into?
That's a great question because coaching is not familiar to a lot of people, even though it's been around for a while. Well, I know everybody's process is different, but for me, after that initial session, if they want to work with me, we usually do about a 5 to 6 month coaching program, and they'll meet with me about every 2 to 3 weeks. There's homework in between. They can contact me by email. I'm very available. And we go through a process. So if I were to work with you, uh, we'd really look at what's working and what's not working in your situation. And then we make that decision of do you want to explore options? And even when I have physicians who it's pretty clear they want to stay clinical, exploring options is really helpful. Then they know later on if these feelings come back, I feel like I'm not trapped, and it takes a lot of pressure off. So depending on where they're going, then we start looking into these options. And if they want to make a change, then comes working on the resume, the LinkedIn profile, doing interview prep. And I walk them through the whole process. I love being sort of a tour guide in this different landscape, so it doesn't feel like bushwhacking at night without a compass. um, I will do interview practice, and then I help them when they're negotiating, and then in that first job. So I have a lot of clients who've done that whole arc, and sometimes it takes a little bit less time. Sometimes it takes a little bit more time. In terms of the cost, coaches vary. Some charge by the hour, some charge by the package. I'd say typically to do a real program with a coach, you're going to be looking at between $5,000 to $10,000. And one way to think about it is not the hours that you're talking to that person, but the transformation that they're bringing you. Because if you're burnout, you're miserable, you're crying on the way to work, you're coming home and you're being the kind of person you don't want to be for your family, is 10,000 worth it for you to be happy again? So that's a typical range. Now some coaches charge by the hour, which there's something to understand about this, because when clients see the hourly rate, it can seem really high. But one of the things is a coach is spending usually 3 to 4 times that number of hours unpaid. So if they're charging $300 for an hour, which to us can seem like a lot, they're usually making less than $100 an hour, because all the stuff we do behind the scenes takes a lot of time and it's not compensated.
Sure. And of course, even though you're only meeting every few weeks, I don't know, if I had a session with you, for example, I would keep it in my mind,
Mm-hmm.
so that during the day I'd say, well, what would Heather think about this? Or what am I going to tell Heather next time? So it's not just that hour we're going to have on the phone or on Zoom, that it's a process, and $10,000 won't even buy you a sports car.
Mm-hmm.
So in terms of, enhancing your life, it's certainly, a sizable chunk of cash. But if it's going to make a difference,
Mm-hmm.
in your future, um, well, here, I'll just throw this out. Have you ever had a client who, after 6 months, who just said, Heather, this was like a total waste of time?
Thankfully, I have not had that experience.
All
And
right. So that hasn't
yeah,
happened, and you've
yeah,
had
no.
hundreds and hundreds of clients. So it looks like the
Mm-hmm.
process does help people. And I suppose some might just go back to do what they were doing, but with a little
Mm-hmm.
more
Yes.
enlightenment. I could see how
Mm-hmm.
that could happen, and sort of, well, I really didn't have it so bad. And I've looked at these other options. And,
Mm-hmm.
if I tweak the system a little bit, and certainly that's what I've been doing personally over the years, is just trying to tweak, the positions that I get so that
Yeah,
they,
yeah. Mm-hmm.
work for me. But I haven't had the benefit of a coach.
Mm-hmm.
Might have made it easier. All right. Well, we're just about ready to wrap up. Is there
Mm-hmm.
anything you'd like to add before we close?
Sure. Thank you, Andrew. This has been lovely. I would say if you're out there and you're thinking, ugh, there's so many coaches, like, should I even bother trying? I would say think about all the diet books and people who help with weight loss. And if someone said, I'm not going to write a diet book because there are already these ones out there on the shelf, there's too many, you know, they'd lose the help that you were going to give them. And there's always room for someone doing something well that helps. And if you think about this three-legged stool of a successful coaching practice, if you can do these three things, you can have a great business. So the first leg is that there's a pain point that potential clients are searching on at 2 a.m. on Google for help, and that they're willing to pay to have some help. The second leg of the stool is that you have a solution. You have a way to help them, and you know you can do it. The third leg is that they can find you, because you can be the best coach in the world, but if they don't know about you or you can't distinguish what you do and how you help them, then you're not going to be able to help them the way they need to be helped. So if you can do those three things, it doesn't matter how many coaches there are already or what they're doing, because you can coach anybody in the whole world.
Thanks for that, Heather. Now, you do have a podcast. which is one way for people to find you. Is it called the Doctor's Crossing or something like that?
The Doctor's Crossing Carpe Diem podcast.
All right.
Yes.
And how would someone find you at 2 a.m.?
Google Doctor's Crossing or my name, Heather Fork. You'll find the website. There are lots of free resources, including the podcast. Just go to the freebie tab, and there's different things that you can download, including a starter kit to help you when you're at the crossroads and you don't know which way to turn. You can also connect with me on LinkedIn.
Perfect. Well, I'll put those resources, a link in the show notes. Well, Heather Fork, I want to thank you very much for appearing on The Art of Medicine.
Thank you. It's always a pleasure, Dr. Wilner. And you look great in that color, by the way.
Hey, that's terrific.
You rock it.
Well, before we close, I'd like to give another thanks to our sponsor, Comp Health. At Comp Health, you can talk with a recruiter who knows your specialty and will actually get to know you and your goals. Consider starting your personalized job search at comphealth.com. Again, that's comphealth.com. Heather, thanks so much.
Thank you, Andrew. Have a great day.
This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com